Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hi, everyone. I'm Nario Cantu, and welcome back to the Friendly Pharmacist podcast. Today, I want to shine a spotlight on a topic that doesn't get nearly enough attention: the role of pharmacists in today's healthcare system. When people think of pharmacists, they often picture someone standing behind a counter counting pills. But the truth is, our profession has evolved dramatically, and pharmacists now play one of the most important roles in patient care, especially in community settings like ours. So today, I want to give you a clear and honest look at what pharmacists actually do, how we support your health, and why we're such an essential part of the healthcare team. Let's start with the most fundamental part of our job: medication expertise. Pharmacists are the medication specialists of the healthcare world. We spend years studying how drugs work, how they interact, how they're absorbed, and how they affect different conditions. Every time you pick up a prescription, we're evaluating your medication profile, checking for interactions, duplications, dosing issues, allergies, and anything else that could cause harm. Many people don't realize how many potential problems pharmacists prevent simply by reviewing prescriptions before they ever reach your hands. It's one of the most important safety nets in healthcare. Beyond safety checks, pharmacists play a huge role in education and guidance. We help you understand how and when to take your medications, what side effects to watch for, and how certain lifestyle habits might affect your treatment. Whether it's explaining a new diabetes medication, adjusting inhaler technique, or helping someone transition from brand to generic, pharmacists make complicated information easy to understand. And because we're accessible, you don't need an appointment to speak to us. We're often the first point of contact when patients have questions or concerns. Another essential role we play is in chronic disease management. Many conditions like diabetes, hypertension, asthma, and high cholesterol require ongoing monitoring and adjustments. Pharmacists help manage these conditions by tracking your progress, performing routine screenings, recommending over-the-counter support, and collaborating with your doctors to optimize your care. In many communities, pharmacists fill gaps where access to physicians may be limited. We offer blood pressure checks, blood sugar monitoring, immunizations, and medication reviews that help keep people stable and prevent unnecessary hospital visits. Speaking of immunizations, pharmacists are now one of the largest providers of vaccines in the country. Whether it's flu shots, COVID-19 vaccines, shingles, pneumonia, or travel vaccines, community pharmacies make preventive care accessible and convenient. This is especially important for people with busy schedules or limited transportation. When pharmacists stepped up during the pandemic, millions of people saw firsthand how essential our role is in protecting public health. Pharmacists also play a major role in mental health support, something people often overlook. Many patients feel more comfortable talking with their pharmacist about sensitive issues like anxiety, depression, or medication side effects. We provide guidance on treatment options, help monitor progress, and ensure medications are used safely. Sometimes just having someone listen and explain things clearly can make a world of difference. Another area where pharmacists shine is compounding and personalized medicine. Community compounding allows us to create customized medications for patients who need unique formulations, children who can't swallow pills, patients with allergies to certain ingredients, individuals needing specialized strengths, or even medications for pets. This personalized approach fills gaps that standard, mass-produced medications can't address. What makes community pharmacists truly special is the relationship we build with patients. We learn your story, your challenges, your preferences, and even your family. We're often the first to notice changes in your health or medication needs. That personal connection allows us to provide care that is both knowledgeable and deeply compassionate. In many ways, pharmacists are the most accessible healthcare professionals, guiding patients day after day, year after year, through every stage of life. As healthcare becomes more complex, pharmacists continue to take on expanded responsibilities, including telehealth support, medication synchronization, smoking cessation programs, point-of-care testing, and more. We're evolving right alongside the industry, always with the goal of improving patient outcomes, reducing barriers to care, and making healthcare more understandable and more human. Thank you for joining me for today's episode of the Friendly Pharmacist podcast. I'm Nario Cantu, and I hope this conversation helped you see the pharmacy profession in a new light. Pharmacists are here not just to dispense medications, but to support your journey, protect your safety, and help you live your healthiest life. If you enjoyed this episode, please follow, share, and join me again for more friendly, practical health discussions. Until next time, take care, stay engaged, and remember, your pharmacist is always here to help.